Good afternoon, everyone. Thanks for joining us. We're going to give it a couple of minutes to fill the room up. Afternoon again, everyone. We're going to give it a couple minutes to fill the room here. Good afternoon again, everyone. We'll give it one more minute to fill the room. Thanks for joining us, everyone. We'll give it about 30 more seconds here. All right. Well, good afternoon, everyone. Thanks for joining us once again for our weekly Wednesday webinar series. Today's webinar is on chapter support and growth in 2021. My name is Brett Spitali. I'm the Vice President of Advancement here at the National Hemophilia Foundation. If at any point during the webinar you would like to ask a question, please use the Q&A feature at the bottom of your screen. We have NHF staff members monitoring these questions, which we will pose to our presenter after the presentation. This webinar is being recorded and will be available to the community beginning on Friday, March 12th. I'd like to introduce our presenter today, Michael Craciunoiu, who is the Vice President of Chapter Services here at the National Hemophilia Foundation. Thank you for taking the time to join us today, Michael, and I will now turn it over to you to get us started, sir.
Thank you, Brett, and thank you all for joining us on this Wednesday as we're talking about chapters today. So I look forward to sharing some information with you and then allowing ample opportunity for some questions and some dialogue. So I'm going to go ahead and jump in to get started. So this kind of lists what to expect in our conversation today. I'd like to share with you who represents the chapter services team and what work they might be focused on, and share a little bit of that information. I'll probably take a little bit of a step back, not knowing where everyone is in terms of their knowledge of NHF's history with chapters. So I'll do a recent history of NHF chapters and kind of the evolution that we've taken in chapter services to adapt and evolve in response to chapters evolution. Then we'll discuss some 2021 priorities and activities that we're working on. And then as we mentioned before here, allowing some opportunity for some question and answer. So this is the chapter services team, starting in the bottom left-hand corner of your screen. That is Kenneth McElderry, Director of Chapter Development. In the top right, or top left, I'm sorry, above Kenneth would be Christy Harvey-Simi, also Director of Chapter Development. In the middle there is Nick Craciunoiu, and that he is the the Chapter Development Specialist. In the middle is Katie Cooper, Director of Chapter Advancement. I'm in the top right-hand corner, and in the bottom right-hand corner is Elizabeth Molnar, and she is the Manager of Chapter Advancement. And I feel very blessed to have this team. It's a very strong team, lots of good, diverse working experiences with many other nonprofits in areas of fundraising and nonprofit management. And there's a wealth of experience here and lots of good people that I get to work with every day. Very proud of my team and looking forward to growing. And that's where that question mark comes in the middle of your screen there. We have a position open right now to add to our team to extend the wealth of knowledge that we have, the breadth and depth of what we're able to accomplish and work on with chapters. So we look to be adding someone to our team, hopefully in the next month or so, as we have that position open and are doing interviews right now for it. So our team has grown considerably over the years, and I'll talk a little bit more about that when we look at some of the evolution But most of that has been in response to the needs that chapters have in the areas of supporting board work and supporting the progression of our nonprofits that are our chapters, as well as to help them with diversification of revenue and other project-based things that they have. So wanted to introduce that team and share them with you, as many of you might have interacted with them out in the field at some time or another. I wanted to share this with you. This is kind of a map that we've created as a point of contact for how we've got the country broken up and how we divide this. So a lot of our work is project-based with chapters on specific topics and challenges and opportunities that they face. We do lots of different trainings that might be customized as one-on-one, but we also bring chapters together a couple times a year to be able to share other information with them. So we do all kind of tackle things as a complete team, but when in doubt, chapters do have opportunities to reach out to who their point of contact is when they don't know exactly who they need to connect with on a different topic. And we've had that divided out. And as you look at this, the red dots that now appear on the screen, this is where all of our staff is located. So I think it's important to mention that our team is entirely remote. We have always been remote, despite now a lot of people going to remote work in light of the pandemic and where our current situation is. Our team has always been remote. We've always been outside of the NHF office, interfacing with chapters, working on the ground level with them, and we are spread out across the country to hopefully adapt and be able to support them in their own backyards and be more responsive to the needs that they have. So in our work, this is up in the top left-hand corner, is a value statement for our department and the things that kind of represent what we focus on. But really, a lot of our interaction is with board members for local chapters, the staff members for local chapters, as well as volunteers. And those are three very distinct roles, but we do a lot of work with those groups and primarily kind of where they intersect, the chapter leaders that support that. So a lot of our work is with specific leaders in those different subsets and how we might support the work that they have and the opportunities that are presented to them at the local chapter level. So what does that look like? And this is kind of a busy slide with lots of different things, but really this is us taking opportunities to work alongside chapter leaders on challenging projects and activities, the things that are presented to them. There are obstacles, sometimes there are opportunities for growth or expansion into different areas and somewhat unknown, and charting those territories is difficult. So we work alongside chapter leaders on a lot of those challenging projects and activities. In the middle there, the developmental relationships, we do lots of coaching and mentoring and have created communities of practice with a closed Facebook group that we have for chapter leaders to be able to interact with each other, to interface with each other, to ask questions, to build some of that knowledge base and sharing expertise by some of the things that we create, both through that online portal as well as smaller cohort groups and other subsets of chapter leaders that we might work with on specific projects. And then we certainly do a lot of different face-to-face trainings, although we have not done that in quite some time and hope to soon. But those face-to-face trainings could be small group, they could be larger group. We do bring all of our chapter leaders together for an annual chapter leadership seminar. And obviously there's a chapter track at our annual bleeding disorder conference as well. So just wanted to kind of paint a picture as kind of the types of work, our approach, and how we might focus on some of the work for chapters. So I'm going to take a step back a little bit here and kind of share with you some recent history of the evolution of chapter services. And interestingly enough, we are a very new department in the grand scheme of the organization that is 73 years old. Our department's only about 12 years old, and we were established as a function to help support the success and growth that we were seeing with opportunities with chapters and what they might need. So I'm going to dive into kind of the recent history as looking at how we've adapted the chapter charter agreement to address some of those things. So back in 2009, chapters had an opportunity to have this department that now has been established to support the work that they have. NHF has always worked with chapters, but never had that department that was dedicated for that until some of those recent years, and looking at the chapter charter agreement. At that time, we also allowed for 5 organizations to quote unquote merge or become part of NHF's 501c3. So for purposes of policies and procedures, and they are employees of NHF, just like myself or the team that I had presented before. But from a program and service perspective, they have a great deal of autonomy to build and adapt to the community that they're serving. And so at that time, 5 organizations decided that they would want to be a part of NHF and decided that they would merge. And then over the course of the last several years, we've also had 2 additional chapters. So we have 7 of our 53 chapters that are directly a part of NHF's 501c3, and the remainder of which we have a partnership agreement with them. They are their separate own organization, and we work to support the work that they have. In 2012 to 2014 chapter charter agreement, with those opportunities and establishing a department, we had tremendous growth in the number of chapters that we had. We went from 35 chapters to 54 chapters by the time you get to 2014, and looking at that. And so lots of growth, lots of opportunity. We created some staffing grants to hire the first ever executive director for many of those chapters, and we're helping them grow and expand into other areas. And as we move to 2015 to 2017, there was a need to create some consistency, a roadmap, so that the expectations that if you move from one area to the next, that there may be a chapter that's in your backyard that has an opportunity to interface and connect with people, and what that might look like from one chapter to the next to create some level of consistency. So we established a chapter review process to help build that roadmap. We also had the opportunity to present chapter of excellence awards, and those were given to chapters that in that chapter review that were doing a lot of best practice, that we wanted to be able to recognize them in those areas. And we've awarded, since its inception, we've awarded over 165 chapter of excellence awards since 2016, and are very proud of our chapters for their growth and evolution and the hard work that they've put in to really respond to the needs of their local community. And so as you look through that, there's a big question mark on 2021. That's because we're right in the middle of trying to revisit what the chapter charter agreement might look like and what chapters need now, because they are different than what they were at one point, what they might need now in order to find success locally. This is a group of chapter leaders that we've put together to help support that. I've only had one call with these chapter leaders late last year, but I hope to pull this group together. And in fact, I need to update this slide because I think we've had 1 or 2 other volunteers that have stepped up to ask to be involved. But this group of chapter leaders will be our sounding board. They will help us develop a chapter charter agreement that's not only meaningful for NHF, but also meaningful for our chapters. So want to give a shout out to all of these chapter leaders for their commitment to helping us as we evolve the chapter charter agreement. So let's look at this evolution. As you look at the far left, 2012, this is an actual case study example of one of our chapters, although I would say that many of our chapters' growth has looked very similar to the example that we have here. But moving from an all-volunteer organization with 5 board members, a very small board, all of which needed to be very hands-on because there are no staff. A smaller budget, maybe only doing 2 or 3 events a year, and really only serving families and individuals affected by maybe hemophilia A and B. And as you progress and look at 2020, you see that this same organization, 8 years later, is in a position where they have 2 full-time staff, 7 board members that now role needs to change because where we might have been hands-on before, now we need to provide more oversight. Now we need to be more strategic, and our role changes and is different. The budget obviously has gone up tremendously to support some of that growth, serving more families and serving subgroups like von Willebrand disease, women with bleeding disorders, teen tracks, other things that many of our chapters have evolved to accommodate. So really our response, our ability to evolve has really been in response and has mirrored the evolution of our chapter leaders. With their growth, they have changing roles, changing responsibilities, different challenges that they might not have faced when they were an all volunteer organization. So much of our work has been through conversations, small groups, observations, data collection, supporting a lot of what we might want to try to evolve there. And then all of this is really driven by our approach and our commitment to the chapters. And that is really our desire to support local leadership development needs and meet chapters exactly where they're at. To build local and regional solutions. There's not a one size fits all. What one works in one area may not work in another area. We want to share in the triumphs and challenges that chapters have alongside leaders. We want to be able to celebrate their successes and to be able to be alongside of them as they face challenges. Because our goal is really to ensure the sustainability and relevancy of our chapters and the communities that they serve. Also contributing to this, and you may have seen this on many of our president and CEO's presentations. Len Valentino has presented it many times talking about the blue sky vision and opportunities, things that we're hearing are things that we may need to adapt to. So these are also contributing factors that we need to weigh in how we might want to evolve what chapter services looks like. Also contributing to that, you see that this is also probably a slide that many of you have seen in other presentations, but these are the approved strategic imperatives for NHF. And you will notice that we have one strategic imperatives that's really how do we adapt and share and incorporate these imperatives at the local level with chapters. And that's really a focus for where our team is going to be intersecting with many of our departments and chapter leaders to help bridge the gap and make these things also relevant at the chapter level and what they might look like. So these are the 2021 objectives for our department. We are wanting to take a vested interest in listening to chapters and hearing what they have to say and clarifying expectations and building and continuing to build that trust and transparency in allowing chapters to be a part of where we're going and what that looks like. Obviously, number 2 is kind of what I mentioned, that we want to be able to share a lot of these strategic imperatives, the tactics, the strategies incorporated by many of the departments at NHF, and what that might look like, and how do we customize that at the local level, and what that might look like for one of our chapter partners. We're always looking for ability to collaborate both at a corporate level as well as other organizations that may have similar interests and opportunities that might be beneficial both for NHF as well as for our chapters. And seeing that we're kind of a liaison between NHF and our chapters, this is a natural role for us to play in looking at these mutually beneficial opportunities. The objective here, obviously, in thinking about looking at the chapter charter agreement is how do we build an agreement that facilitates sustainability and exploring opportunities for regional projects. Many of our chapters, in light of the pandemic, have been very creative and innovative, and they've partnered together. And in some ways, this pandemic has made the world a little smaller because individuals have been able to access through technology trainings and opportunities that might be actually presented by someone halfway across the country. And we've seen very innovative things with chapters in other areas that don't even serve the same service territory, partnering together to work on things, to innovate and be creative and respond to things that might be needed by our local communities. We're going to be offering a capacity building grant program to help with that. How do we take these imperatives and what do they look like at the local level? And we're going to be providing some seed money to chapters that are going to align projects with some of these tactics and strategies that we're looking at to try to accomplish our strategic imperatives. And so we shared this with chapter leaders late last month and are looking forward to having this opportunity be available to them with the idea of having these awards granted by mid-year. And they would be one-year grants, and we would be looking at potentially renewing some of those if we find great gains or opportunities to extend those projects beyond that 1 year. But this is a great opportunity to help chapters in adapting to some of the things that they're seeing at the local level that may align with needs and opportunities that we have as well. We have our board development series that we have been doing for several years now. Most of this is in the form of face-to-face board retreats that we had been conducting, but in light of the pandemic, we have also adjusted, and we've been able to offer many of these trainings and opportunities virtually. And we've had to adapt a lot of those things, but we do look to hope to get to back to the face-to-face board retreats, strategic planning, succession planning opportunities that we've been working on with chapter leaders. And we look to incorporate more of that as we move into 2021, because our role is not just to support the staff at a chapter, but also to help that board evolve and adapt and be more for their local communities as well. I would be remiss if I didn't mention our Unite for Bleeding Disorder walk. It is a very substantial thing that we do, and for many chapters, it is their largest single source kind of fundraising event that they do annually. And even in light of the pandemic, we were able to, in 2020, have over 3,500 participants participating virtually and supporting their local walks in 42 different cities. And lots of opportunity there to expand. And you'll see in the bottom left-hand corner that you can follow us on Facebook to find a walk near you. And many of you have participated in those walks, and we greatly appreciate your support of your local chapter. We're very proud to say that all of the money that's raised locally stays locally. So when an individual contributes to their local walk, they know that they're contributing to their specific local chapter who's hosting those events. And we've been able to do that because of the great sponsorship support that we also receive at a national level from, you'll see for our presenting sponsors for 2020 with Takeda and the Hemophilia Alliance, which is where I'm moving now. So of these two presenting sponsors, the Hemophilia Alliance is relatively new as a presenting sponsor of the walk, and we wanted to work with them to leverage opportunities to engage with our local hemophilia treatment centers. Many of them have been very gracious and very engaged in supporting local walks, and we wanted to provide more incentive for that. So I know the Hemophilia Alliance has a project, Harmony in Hemophilia, that they have where they are dedicated to trying to find new opportunities, ways to engage, and how chapters and the local HTCs might be able to work better together to accomplish similar goals and initiatives. And so we look at this as an opportunity to dovetail with that. And with this, we'll be giving scholarships to the 2022 Bleeding Disorder Conference for the highest fundraising totals in the different walk categories that we've broken out. So we know that not every area can compete with other areas in terms of fundraising totals. So we've taken our walks and broken them into sizes based upon what they might be able to raise locally. And we'll be providing for the largest fundraising totals for those different HTC teams in those categories. We'll be providing those scholarship opportunities to be able to give back and help those treatment centers send somebody to the annual Bleeding Disorder Conference, because we know that's oftentimes something where there are limited budgets and opportunities for. And I do want to point out Takeda, this is their 13th year being the presenting sponsor. They have been instrumental in allowing us to build this into a meaningful program for our chapter leaders. And they have been very good with their support, not only financially, but They have been very good at giving feedback and offering assistance and resources and what can we do to help support these local walks. And I want to thank them for their dedicated ongoing support of that of our walk program by supporting that for 13 years. And they are the presenting sponsor for our team captains awards that we provide. So NHF does a small token, a little gift to all of our team captains. And this year we'll be offering some of those Converse customized tennis shoes in for our team captains that raise the most for their local walks. So I want to thank both of these presenting sponsors, as well as all of our national sponsors that are also supporting this. And they've all been very gracious in making sure that they're committed to this. We also have Unite Day, which is something that we adapted in 2020. We were in a position in 2020 to try to change the way that we've been delivering the walk. It has always been a face-to-face. It's been very focused on building community at a local level. And how do you do that in this virtual environment? So one thing that NHF did is we've quickly adjusted and tried to adapt with the changing of landscape. And we offered a Unite Day, which 17 of our chapters hosted their walk on a specific day, and we had a big celebration. The chapters that didn't have a walk on that day had opportunities to maybe use it as a stewardship event to thank their walk that may have already occurred, or as a kickoff event to get their walkers motivated for a walk that may be coming up down the road. So I wanted you all to save the date for Saturday, September 18th. That will be our Unite Day this year. Even if we were able to get back together, and fingers crossed that that's happened, that will be happening in the fall. Even if that's not an opportunity for everyone, we do know that the walk is a place for everyone, and that we do see the power in bringing people together in the celebration of what we're all trying to accomplish in supporting our local chapters. So this is a great opportunity. I hope to see all of you guys there. So please save the date. There'll be more information about that as time goes on. Hopefully we'll have some good surprises, maybe some interesting speakers and other things that will happen. And you'll see other festivities and events around this as we get closer to that September date. We do have walks all the way across the country. You'll see these dots all represent the 40 walks representing the 37 chapters that we have. So some chapters have more than one walk that they conduct. But if you don't see a walk in your area, you will see that we have many of our chapters that do. But as I mentioned, 53 chapters, 37 of which participate in the walk program. And we do want you to still try to find the chapter in your area to support them. Some of them do their own walk that doesn't fall under our umbrella, or other fundraising initiatives. And so we are very much in wanting folks to support local and help what they're trying to accomplish at that local level with chapters. I want to end by kind of summing this up with a little bit of what our response from the chapter services level has been in response to this pandemic. We were in a very unique position, actually, this time last year. March 9th through the 12th was our chapter leadership seminar last year. And that's right when all of the things started happening with closures and many of the quarantining and guidelines for how we might adapt and what was on the road. All of that was happening when we were all together with chapter leaders. So we even adjusted the last day or so of our programming. And Len had an opportunity to chat with chapters to let them know that we're committed to adapting for them and serving them. And some of our chapter leaders couldn't make it because all of this stuff was happening at the time, and we created remote opportunities for them. But ever since then, we've really tried to be on the front curve of being the ones that chapters could come to for resources and assistance and help as they needed that. So we worked with HFA. This was a joint project that we had to try to host a weekly webinar series. And it was actually, we did it on Wednesdays and we called it Wednesday webinars, similar to what you guys have here. And this was, we held 10 of these between the months of April and August to try to create topics, have conversations, react to dialogue, changes that are happening, new guidelines, new information that's coming out, whether that be related to the CARES Act and the PPP loans, whether it's how do you do fundraising, how do we adapt some of that, navigating patient assistance and the increase that we had in patient assistance requests at the local level. How do we do camp in this virtual environment? So all of this was something that we tried to do and create topics every week to be on the forefront of this and on the outer edge to respond as chapters were telling us the things that they needed. One of those things that we did was to offer some virtual meeting assistance. Our team was relatively familiar with conducting webinars at that point, but many of our chapters weren't. That many of them didn't even have Zoom accounts yet. They didn't know how to use that or maybe host it in a way where they could fully utilize all of the features of polling and breakout rooms and all of those things that we're now probably all experts in, but we were all learning at the time. And so we actually hosted 13 different chapter meetings. So chapters that had to quickly change their event from face-to-face to now virtual, they used our platform. We helped them and supported them in that interim as they were becoming best practice experts overnight in this virtual delivery format. So something we're very proud of and we're able to do and respond to chapter leaders to help them host those things. And another big piece that we did, and this is, I thank all of the NHF leadership for, kind of allowing us to look at and explore these things. But with all the travel that we had been doing for supporting chapters, we had some cost savings. Our team wasn't traveling because we were all, trying to do things remotely and trying to stay safe and follow those precautions. So we had some budget savings and we reinvested that in chapters. We decided to put that money back out there. NHF made a huge self-investment along with some of our other generous industry partners with Pfizer, Sanofi Genzyme, and Genentech, who all came on board and said that they also wanted to try to be a part of something to help chapters as they're adjusting for all of these things. So we gave 59 NHF chapters and HFA member organizations. So this was not just reserved to just our chapters. We knew that many HFA member organizations that may not be chapters were also in great need of some assistance. And we decided to open it up to all of these organizations. So even though we have 53 chapters, not all of them applied. And we did have a handful of other HFA member organizations that we were able to support with a $7,500 grant to help them adapt. And the Hemophilia Alliance graciously matched that contribution to allow for $15,000 to come to each entity that applied for these awards. So all of these entities were able to get $15,000 to adjust for some of the things that they were having to do. And most of that went to things like patient assistance or operational expenses, having to do some things differently, purchasing of Zoom accounts, purchasing of other technology, new computers for staff that now have to work remote, all of these different things that were happening. This funding helped make those things possible. And so very thankful for NHF leadership and these industry partners and the Hemophilia Alliance for their generous match in making those things happen. So that is, I think, brings me to the end. And I know I talk very fast, so I hope you were all able to keep up with that. But one of the things I was looking most forward to in the presentation today was the opportunity for questions, because I find that that is the most beneficial way for me to learn the types of things that interest folks that want to attend our webinars, but it also lets me know of things that we need to adjust to help to serve our chapters. So I will open it up to questions and hopefully have some good dialogue with you and get some of your questions answered.
Great. Thank you, Michael. Again, if you would like to ask any questions, please use that Q&A feature down at the bottom of your screen. We do have some that have come in, Michael, and I'll start shooting them over to you here.
Sure.
If I live in a state where there is a non-affiliated NHF chapter, does that mean I cannot interact with NHF? How can I get my chapter to engage with NHF?
You can absolutely interact with NHF. We do oftentimes try to re-engage, and I know many of our non-NHF chapters that might be HFA member organizations or may not even be affiliated with either still do contribute to Washington Days, which we just had last week. We do partner with them on many things still. So even if they're not a chapter and don't have all of the same benefits and resources available, we still want to support those communities. We still want to support those organizations. It may look different than what we might do for our chapters, but we definitely want to support those organizations. So I would encourage you to reach out to those organizations and perhaps let them view this archived webinar and revisit that conversation. Because I will say, if you didn't know, and I should have referenced this, but it doesn't cost anything to be an NHF chapter. There are some set required standards that we ask all of our affiliate partners to follow, but it doesn't cost anything. And we are very flexible in grandfathering entities in that aren't able to meet our required standards right off the bat, but we're going to develop a plan to potentially meet some of those standards. So we're always looking to give back in any way that we can. And as soon as we get the next chapter charter agreement that we're working on established, it is my hope that we will reach back out to some of those organizations to revisit that partnership and maybe have them come back on as a chapter or join us as a chapter if they never had been. So we definitely are encouraging of that. And I would say reach out to a member of our team if there's something that we can do, or engage with your local organization and prompt them to do so. We're always interested in those conversations.
Great. Thanks, Michael. Next question kind of dovetails nicely. What do you what do you see the sustainability for chapters as organizations in the future? What is NHF's role in making sure that they are still there for the community members?
Yeah, I think it's a good question. I think it's very situational. Kind of as I mentioned before with regionalized solutions, what works in one area, what works between one set of chapters may not work in another area. And so we do realize that there's a certain amount of this that is needs to be customizable. As I mentioned with the pandemic and some of the innovation that we've seen, the world has gotten a little smaller. I don't know if when we look at the thinking of the blue sky vision of what we might look like in 2030, we may not need as many chapters as we have now. We may need more. And I think those will be, a lot of those conversations will be dependent upon what we see, where we go, and what our relationships are with chapters. So I think there's certainly opportunities for that engagement. I do know of a few chapters that have been discussing in recent years the ability to potentially merge. So chapters with neighboring territories that might be wanting to explore, hey, what might it look like if we became a single entity instead of adjacent organizations with neighboring service territories? And I think all of those things need to be looked at differently, because I don't think that there's a cookie cutter way to do that. We do have some expertise in supporting chapters that have explored those things, even if it is them looking to merge with NHF, as I mentioned with that chapter charter agreement. We've done that with chapters before and had them fall under our umbrella. But it might also look like that between two neighboring organizations that want to merge together to be a single entity, a single chapter. And so our goal is to be responsive. Our goal is to make sure that the community that they serve still receives the same quality and expectation of service. And so whatever we can do to support the local leadership in making that happen, that's really our number one priority. Whether it's 53 organizations, 20 organizations, 70 organizations, in some ways is irrelevant as long as the community is getting what they need. And I think as long as we stay focused and patient-centric in that way, we can't make a huge mistake with some of those things. So that's, I think, hopefully answers that question.
Great. Thanks, Michael. Next question comes in. How does NHF ensure or help facilitate relationships with HTCs and chapters?
So we would like to do more of this as we move forward because I think there's a tremendous opportunity for that. We have been involved with some chapters and HTCs in helping to look at things such as the development of an MOU between the two entities and what that might look like and how to help bridge that partnership gap. So, where I said we kind of play this role of trying to create mutually beneficial relationships with NHF and chapters, I would also like to say that we have an opportunity to do that between HTCs and local chapters. So we try to do that to the extent that we can. Obviously, those are separate organizations. So if they choose to do things differently, they certainly can, and we try to adjust around those things. I will say that in 2014, we also gave out 14 capacity building grants to HTCs, $726,000 that we gave out to 14 different HTCs that had a local capacity building project that had an intersection and partnership with local chapters to build things. So maybe there's opportunities for us to not only leverage relationships, but also maybe look at providing seed money and resources to help make those things happen and perhaps have them happen easier or more effectively. I would love to be invited to those conversations if there's ever anything we can do to support helping chapters and HTCs working together.
Maybe, Brett, I can add to what Michael said. I think if you recall back to the slide that Michael showed about the 6 strategic imperatives that NHF has adopted, Michael pointed out the 4th strategic imperative around creating stronger chapters. But I'd also like to point out the 2nd strategic imperative, which is around enhancing patient centricity. And we're all here for the same purpose. We're here because of the patients. HTCs, chapters, NHF all exist to support the patient community. So if there's something that we can do to help support that patient community by bringing chapters and treatment centers closer together, whether that's through education or advocacy efforts or support in any other way, that's something that we want to know about. We want to understand where your gaps are and what your needs are. So I just want to point that out and commend Michael for a great presentation.
Thank you.
Thanks, Michael. Thanks, Len. A couple more questions that have come in, Michael. But before I do that, I'm going to launch a quick demographic poll. And if you wouldn't mind taking that, participating in that poll, we would appreciate it. And Michael, I'll get back to the questions here. You said that NHF doesn't charge dues, but I see a ton of services given to chapters. How does NHF pay for that?
We have been very fortunate to have wonderful supporters, both industry and non-industry philanthropic partners that have invested in NHF and see the value in helping us help them, if you will. So that's all been possible by the great support that we receive. And my hope is that we can continue to live up to those expectations and grow and adapt as chapters are needed. But it is very unique, I think, as you look at other national nonprofit models to not have dues and subsidiary fees that might be associated with those kinds of relationships. I think we're very unique and very fortunate to be able to do those things at no cost to chapters.
Great. Thanks, Michael. I have another good question that came in, and Len, you might want to chime in on this one as well, too. I've seen that NHF's mission is being inclusive of blood disorders. Given the robust, complex offerings to NHF chapters, what do you see NHF's role with other organizations that serve other diseases and disorders, such as sickle cell?
Yeah, so I can take that one. You know, throughout the first part of 2020, we listened to the community, and that included patients, policymakers, our public partners, for example, at FDA and NIH, Maternal Child Health Bureau, and of course the CDC. But we also listened to patients and our healthcare providers. And it was very clear that there was a need to be more inclusive. We heard from our HCPs that many of them are already caring for patients with, for example, venous thromboembolism. So we've moved beyond the quote hemophilia model to other bleeding disorders, including von Willebrand disease and rare and ultra rare bleeding disorders. And in some cases, platelet disorders are managed in hemophilia treatment centers, as well as venous thromboembolism. And some have even approached a fairly unique named disorder, hereditary hemorrhagic telangiectasia. And in fact, there's a couple pilot sites in the US that are looking at bringing HHT patients into hemophilia treatment centers. But there's also the whole realm of other classical hematology disorders, as you mentioned in the question: sickle cell disease, thalassemia, chronic anemias, for example. And these are all disorders that are faced in our community by our healthcare professionals. And what we see as an opportunity for the National Hemophilia Foundation is to collaborate with and support other organizations. For example, we're really building a robust collaboration with the Sickle Cell Disease Association of America. And I think that this is an opportunity for us to be a good global citizen, to lend our 72 years of experience, expertise, and knowledge to other organizations to help them grow and serve the needs of their patient communities. We're not going to be able to take on all of these patient communities, and that's not the intent. The intent is really to share our knowledge, expertise, and the information that we've been able to garner over decades of work with these other organizations to help them meet the demands of their communities. This is not taking anything away from the bleeding disorders community. I see this as totally additive and supplementing the work that we're doing. And we're looking for unique ways to continue the model that Michael described, where we can support these communities either through education or collaborative opportunities, but also potentially through financial support as well.
Great. Thanks, Len. Appreciate that. Next question comes in, Michael. I know you talked a little bit about the WAC program. This question is: what portion of the WAC money goes back to NHF, and what versus what portion stays at the chapter?
So yeah, 100% of the money that's raised locally stays locally. We were able to perpetuate the national WAC program because of national sponsorship. So we offer pass-through money. So this year, actually, we announced to chapters yesterday because we had this call, so it's fresh in my mind. But we will allow some of that money from the national sponsors actually gets directly passed through to chapters, so they receive a portion of that national money. We also reinvest that money in the platform that we use for fundraising, which is Donor Drive, which is the platform that we use, and allows for chapters to have customized pages and things that they built. We have a texting program that's intersected with that, an incentive program. This year we've done an audit. So all of the money we receive from our national sponsorships is reinvested back in the program and our ability to offer that to chapters at no cost. So chapters don't have to pay to be involved in the National WAC program. They agree to recognize those national sponsors as well as the local sponsors, adhere to and follow some of the guidelines that we've created for that WAC program to ensure integrity across the board as it's implemented. But all of that money that's raised locally stays locally. We don't receive any of that. So I hope that answers the question.
Great. Thanks, Michael. A couple more questions have come in. You talked a little bit about the partnership or collaboration efforts with HFA. Can a chapter be a part of HFA and NHF?
Absolutely. In fact, I think about 85% of our chapters are also an HFA member organization. We've done more in recent years with them. I certainly think that there are many more opportunities for us to continue our partnership. I know that HFA, for example, is very involved with our Washington Days last week and many of our advocacy and public policy efforts. I know that the HFA education team and our education team are working on some mental health initiatives and things that chapters are asking for. So wherever we can find opportunities to partner with HFA, we do. And I think that there are many more opportunities in the future, but they can absolutely be a part of both. If you are a member organization, you can be a part of NHF and vice versa. The only group that's excluded from that are the national chapters, those 7 that I mentioned that are directly a part of NHF. Part of the requirement, or I guess benefit, it would be for HFA affiliation is you get a seat on their board. And obviously, HFA would not want to give a seat on their board to someone that's employed by or connected with NHF as closely as our 7 national chapters are. So they are not allowed to be an HFA member organization. But that too is also something that I've been working with them to explore the potential that would allow them potentially an associate membership or something like that, where they could still access the resources that HFA has. So I think that that just really alludes to the evolving relationship that we have in trying to do more and partner together. Because similar to the comment earlier about HTCs and chapters having the same population, they're trying to do the same thing. I think in many ways, HFA and NHF are trying to serve our chapters or member organizations the best we can. So whenever we can partner together to do that, it's that much more meaningful for the end user.
Great. In that same spirit, the next question that comes in, it looks like this might be the last one, Michael. What is the difference between the support and services that NHF gives versus HFA gives toward the chapters?
It's a good question. I don't know exactly what the entire menu of benefits and services that someone may receive as part of HFA. I know that that is something that may evolve annually, and as they renew memberships with HFA. I know HFA does charge to be a member, although it is a very nominal fee, and much of that is also given back in the form of stipends and grants to member organizations that offer education resources. But I think there are some differences. I know that chapter services, our team, and what the things I presented on today, we don't really share a peer on the HFA side of things. HFA has an education team, they have a public policy team, and they're very good at what they do in supporting the member organizations and some of that, but they don't have a chapter services department that is focused on nonprofit management, leadership development, board development, some of those things that I mentioned early on that we're really focused on a daily basis within our department specifically. We don't really share a peer with HFA in that capacity, at least not in a formalized sense along those lines. So I do know there are some differences, and I would encourage you to reach out to NHF if you have any questions about our benefits or expectations specifically. And I would also encourage you to reach out to HFA to find some of those things out, to make some of those decisions on your own. I don't think that we ever have created a side-by-side list, because we're not trying to be in competition with each other. It's more of individual decision of the organizations on who they want to partner with to accomplish what they have in front of them.
Great. There is another question that came in, Michael, and I don't know if this is something that you'll be able to answer or not. I'm throw it out there for you. Is there an opportunity for merged chapters to utilize HFA's programs offered, or other opportunities to partner outside of sitting on their board?
Yeah, so that's where I mentioned, I know that I've had some conversations in the past, and we'll be revisiting some of those things of whether or not NHF chapters, those merge, the national chapters, the 7 that I mentioned earlier, are not able to be a part of HFA right now. But we have explored the opportunity for potentially those entities to have a blood brotherhood program, for example, or some of those things. And HFA has been very open to that. We just haven't formalized anything to build those parameters. But right now, currently, I don't think that there's anything that can be offered to them, but I do anticipate that there'll be flexibility, and that would be something that we need to explore again. But that also just affects those 7 entities. So, we would have to work on that on a basis of connecting with those 7 entities and HFA and working through some of those things.
Great. Doesn't look like there's any more questions in the queue here, Michael. So I'd like to thank you for taking the time to join us this afternoon. We certainly appreciate your time and expertise, sir. And I'd like to thank each and every one of you for joining us as well. Please note that this recorded webinar will be available on Friday, March 12th at hemophilia.org under the events tab with all of our other archived webinars. Also available in the events tab is our upcoming schedule for our weekly Wednesday webinar series. Thank you again for joining us. Thank you again for taking the time, Michael, and everyone have a wonderful afternoon.